Americans are living longer, but healthcare prices keep going up, and questions about how to provide good care while curbing costs remain unanswered.
On Hill TV's 10-part series, The Future of Medicare, we will be talking to medical experts, providers, and policy wonks about the need to overhaul America's biggest safety net. We'll also dive into the challenges and opportunities of doing so. Our first guest is Michael Chernew. He leads the Healthcare Markets and Regulation Lab at Harvard Medical School. His research focuses on healthcare expenditures, quality of care, and value-based insurance design systems. Dr. Chernew, thanks for being with us here on Rising.
Thank you so much for having me.
Doctor, let's dive into this. Several 2020 presidential candidates have made Medicare for All one of their platforms. Now tell us, what are the benefits of Medicare? Is it a good idea? And what would implementing the cost of that be?
Well, first I want to separate out the benefits of Medicare from the policy proposals of Medicare for All. Medicare as a program has been an essential lifeline for our seniors in ensuring that they have access to high quality care in the United States. And I think by almost any metric, it's been really successful. You know, most healthcare in the United States has been provided by employers, but once people retire and they may not be connected to the employer-based healthcare system, they need an alternative, particularly in their Medicare years when they may face serious health conditions. So Medicare has done a tremendous job of providing broad access to healthcare for American seniors. Medicare for All purports to try and expand the Medicare program across the entire system. Now understand that with the Affordable Care Act, we had healthcare reform almost a decade ago, which tried to address problems of the uninsured in the U.S. And we could have a long debate, I'm happy to, about how it's working or not working, but really it set in place a framework for covering Americans not eligible for Medicare. Medicare for All is not a reform of the Medicare program, it's more a broad expansion. How you feel about that has a lot to do with how you might feel about the government's role in the healthcare system. But one of the big impacts of a Medicare for All program, if you took it literally, would be that prices paid to providers would drop dramatically. In the commercial healthcare space right now, what we, as an employer, for example, would pay for care, we pay significantly more than Medicare pays. If you took all of the patients in the employer sector and put them onto Medicare, the prices that providers would get would be substantially less. And I think that is both a benefit in that it helps control costs and a risk because we have to worry about the viability of the delivery system and the various unintended consequences that would go along with relatively significant cuts to healthcare providers. So that's really where the challenge is in thinking through a proposal like Medicare for All, of which there are many.
Right.
So how does a value-based insurance system benefit healthcare beneficiaries?
So there's different types of things that we mean by a value-based insurance system. Often in the context of Medicare, we mean value-based payment. And the challenges we face in Medicare are largely fiscal. We have an aging population, more beneficiaries, about maybe 2% more a year aging onto the program. The ratio of workers that support the program to beneficiaries who receive the benefits from the program is falling, fewer workers per beneficiary. So we really have to think through the fiscal health of the Medicare program. The challenge with the existing program, for the most part, is that it does not provide incentives for efficiency. There are parts of the Medicare program, for example, many of your listeners may be enrolled in a private health plan offered through Medicare called a Medicare Advantage plan, but much of the program traditionally has worked in a model in which physicians and hospitals were paid for what they did, which certainly is sensible, but the way we've operated that system, it's been quite inflationary. And more to the point, in that system, if a provider organization finds a more effective or efficient way to deliver care, they don't reap any of the savings. So a value-based payment model, of which there's many going on in Medicare right now, does a number of things. One, it rewards high quality of care, which I think is useful. There's a lot of evidence that suggests we could do better in terms of the quality of care provided to Americans. And it provides the incentives for delivery systems to provide that high quality care efficiently. So when providers find new ways to deliver services or things that they might be able to not deliver because they're no longer needed or not necessary, it provides incentives for them by allowing them to share in some of those savings. So most value-based payment models that you see in Medicare now are attempts to find new ways to pay providers that allow them to control some of the money, create and share in some of the efficiencies, while still providing the access and quality of care that Americans need and deserve.
Final question for you, doctor. In your experience, is providing health care through Medicare, does it provide quality care for patients? And is it a viable option to continue for the future?
So Medicare absolutely provides high quality care for patients, and Medicare as a program is certainly an important, viable option for the future. That is somewhat different than saying expanding Medicare is the right policy option. So it's important to separate Medicare good from therefore Medicare should be bigger. There's a lot of other complicated policy issues one needs to deal with. So I'm a very positive, I have very positive thoughts about how the Medicare program's going, and we're going to have to continue to face its challenges as well as a set of separate challenges in the commercial market.
Great. Thank you so much for joining us, doctors. Really appreciate it.
Thank you.
All right, thanks for being here, and we will be right back with a little more Rising right after this.